All right, let's dive right in. Today, we're talking about a brand new presence in the doctor's office, something that could completely revolutionize medicine as we know it, artificial intelligence. So, is it the ultimate assistant, a potential risk, or maybe a little bit of both? Let's get into it.
First, let's just start with a little thought experiment. I want you to picture this colleague. Imagine a partner in the high-stakes, chaotic world of a hospital who is always on, completely up to date, and never, ever gets tired. Just think, what could that mean for patient care? Well, here's the big reveal. This isn't some far-off science fiction scenario anymore. This colleague is already here. And it's not a person in a white coat, it's artificial intelligence. And it is quietly but surely starting to change absolutely everything. Okay, so let's get to know this tireless new colleague a little better. What exactly is it, and how in the world does it operate? At its very core, AI is all about building systems that don't just compute numbers, but can actually think, learn, and adapt. These aren't just fancy calculators. We're talking about machines designed to reason and solve incredibly complex problems, kind of mirroring the amazing capabilities of the human brain. So, how does AI actually pull all this off? Well, it's not magic, not at all. It's really just a set of incredibly powerful tools. So, let's open up this toolbox and see what we've got inside. Inside this toolbox, you'll find three key technologies. First up, you've got machine learning, which is brilliant at spotting patterns in massive amounts of data. Think of it identifying risk factors for a disease across millions of patient records. Then there's deep learning, which is a more complex version of that, and it can analyze medical images like X-rays or MRIs with just incredible accuracy. And finally, you have natural language processing, or NLP, which gives AI the power to understand human language, letting it read and summarize a doctor's own notes. And wow, what a combination that is. This isn't just some theory. In the real world, this toolbox is already helping doctors diagnose conditions way faster, predict a patient's risk for certain diseases, manage these huge patient lists, and even draft complex clinical reports. It's like a super assistant, for real. Now, this ability to sift through mountains of information and suggest diagnoses, well, it leads to a pretty fun comparison. I love this analogy. Just like the famous TV doctor, AI can look at a whole mess of symptoms and data, cross-reference it with this giant library of medical knowledge, and then spit out a list of possible diagnoses, all with statistical support. The biggest difference? It won't insult you while it's doing it. But beyond just coming up with ideas, AI's real power is in handling the raw data that gets you to those insights in the first place. And here is where that power becomes incredibly practical. Look at this. On the left, you've got this dense, paragraph-style clinical report. It's full of critical information, sure, but it's really hard to scan quickly. Now look at the right. That's what the AI can do. It's transformed all that text into a structured SOAP note, neatly organizing all the key points. For a busy doctor, this shift from information overload to instant clarity is an absolute game changer. But, and this is a big but, this powerful colleague isn't perfect. Not even close. This is where we have to talk about some very real risks and this fascinating problem that they call hallucination. So we have to ask the most critical question of all. Can we actually trust it completely? And the answer, at least for now, is a clear and definite no. Just take a look at this real-world example from the source material. An AI was asked to summarize a medical form. You can see right here, it generated a respiratory rate and an oxygen saturation level for the patient. Now, here's the problem. Those data points were nowhere to be found in the original document. The AI just made them up to fill in the blanks. This is what's known as a hallucination. So the crucial point here is that these systems need guardrails. They need very specific human-written instructions, like the one you see here, to stop them from inferring or just straight-up inventing data. The human in the loop isn't just some nice-to-have option. It is an absolute necessity. And this brings us right to the heart of the whole debate. With all this amazing technology, what is the role of the human doctor? What is it that a machine simply can't replace? Look at this number, just 11 seconds. What could that possibly represent in a medical consultation? It's the average amount of time a doctor listens before interrupting a patient. This one statistic really highlights a huge challenge in medicine right now, the lack of time for real human connection. Technology absolutely needs to help fix this problem, not make it worse. And that is the real danger here. If we're not careful, AI could lead to doctors staring at screens instead of their patients, blindly trusting automated reports without thinking critically, and losing that essential quality of empathy. It could become way too easy to just blame the system when things go wrong.
So, if the goal isn't replacement, then what is it? This is where we get to the true, incredible potential of this technology. You see, the future isn't about firing doctors. It's about changing how they work. It's about creating a new kind of medical professional, one who is skilled in both medicine and technology. And this means all of us have to adapt. We have to become literate in these new tools, and we have to build strong ethical rules to guide how they're used.
And here it is, the single most important takeaway from all of this. The ultimate promise of AI in medicine is not to replace human judgment. It's to handle all the tedious, time-consuming tasks to free up the doctor to do what only a human can do: listen, empathize, and truly connect with their patient.
So, in the end, the biggest challenge here isn't programming a better AI. The biggest challenge is actually changing ourselves. It's a human revolution, really, just powered by technology. And the final question that leaves us with is a big one. Are we ready for it?